Good morning all. You're welcome to this segment of the IMO Med Commission. You'll recall that from the 30th of January 2023 to the 4th of February 2023, we had a robust Med Commission certified by the Association of Nigerian Physicians in the America. And during this period, we met some very big cases that we just didn't know what to do. But you will also recall that we had the relationship with a private hospital in Owerri here, Regions Neuroscience Hospital. And the medical director was part of our team for the preparation of this, of the Med Commission. And during the period when we saw these babies with defects in their hearts, he took it upon himself to discuss with some cardiac surgeons. And today we have in our midst 2 cardiac surgeons, senior surgeons who have come in to do these surgeries for these children. Dr. Osin Zewi is a consultant cardiac surgeon from the UK. He's the director of heart surgery program here at here in Regions. And Dr. Vijay Agarwal is a consultant pediatric cardiac surgeon from Charak Hospital, India. We are happy to have them here, and His Excellency the Governor is very, very delighted that this is taking place. Today we're starting the surgery, and this surgery is going to run today, tomorrow, and subsequently the follow-up will be done. So I want to say a very big thank you to Regions Hospital on behalf of the government for also giving us certain things pro bono during this period. I want the people to know that this is not going to end here. It is going to be a continuous thing, and this is just the beginning of a better thing, of better things to happen in Imo State. So on behalf of the governor, I welcome the 2 cardiac surgeons who are flanked. By my right is Dr. Nzewi, and by my left is Dr. Agarwal. So, Dr. Nzewi, you're welcome.
Thank you, my good friend, Prosper Success, the Honorable Commissioner. I want to say this, not because the press people are here. I met him during the AMPA program here in the hospital, because they used part of our hospital for their vascular surgery. And this baby came up, I challenged him, I said, Prosper, get money, and I will do my best and we'll get this. And 2 weeks after, he phoned me and said he's got money for this baby. I said, Prosper, I cannot come all the way to do 1 patient. Go and get money for 2 patients. He went and got money for 2 patients. Fortunately, one of them died before we could come. And he relayed that to His Excellency, who was very, very upset, and said, go and do whatever it takes to get them to come and do this other one. I don't want to die. So we added another patient, so 2 of them, isn't it? Plus the adult that I'm going to do is not part of the program. I want it to be on record that this is the first time in Nigeria that a government is looked into the plight of an indigent patient in their state and decided to sponsor the patient. And I think that is the way forward, because I'm going to challenge other governors to do the same. And like he said, I look forward to this being on regular basis. What I can promise you, Prosper, is that the Save a Heart Foundation, for which I'm Executive Director in UK, will partner with you. Whatever you get, we match it in order to do more cases. My good friend Vijay Agarwal, who we've known for 18 years now, and he's always wanted to help me do something in Nigeria. So he's keyed into this, no matter the difficulties and the deficiencies in our facilities and everything. He is going to be part of it. I hope I speak for you, Vijay.
Sure.
Yeah.
Okay, my name is Mrs. Uzodimma and I'm the hospital administrator to Regions Stroke and Neuroscience Hospital, representing my CMD who is unavoidably absent. We, like the commissioner said, we keyed into the AMPA mission in collaboration with the state, and we are still willing, as much as we can go, in care for our indigent patients in this state. We want to really appreciate the surgeons and even the governor for this milestone, and we believe we will achieve a lot. Thank you very much.
The gentleman of the press, you may want to ask question, and then we can help you answer that in the most simple way that we can, that's understandable to them. But before I start, the two cases we are doing today are actually in the extremes of complexity. The extremes of complexity. The first patient is 6 months old or 5.5 months old, male patient who was born with a complex congenital heart disease. Initially, it was actually thought he has one hole in the heart, but he actually has 2 holes in the heart, in addition to abnormal vessel connecting where it shouldn't connect. So he has an ASD, VSD, and PDA. ASD is atrial septal defect, which is connecting the 2 receiving chambers of the heart, connecting the right to the left. It shouldn't be connected, they should be separated. And then getting to the pumping chamber, which is the ventricle, there's also a hole connecting 2 of them. And as if it wasn't enough, as the artery that comes out from the right side that goes to the lung to get oxygenated, and the arteries that comes out from the leg that supplies the head and the limbs, there's also a connecting tube between them. So it's as complex as it can get. If you want more technical details on what to do, VJ will explain to that. That is one. The other one is actually a 12-year-old boy, isn't he? Yes. I believe he's from your area, actually. Yeah. And he's been struggling ever since he can't cope with the school. He has a serious congenital heart problem called tetralogy of Fallot. What that means is tetralogy means that there are 4 defects in the heart. So you can imagine your heart's normal, and somebody, a little boy, has 4 different abnormalities in his heart. So we're going to, VJ is going to correct that, total correction, and hopefully should be able to recover and go back and start school. So it's something that it should, by the grace of God, it will go well, that you should take pride of and follow these kids as they grow.
Okay, I want to ask this question. Honorable Commissioner, it comes to you. I remember that the last time we went to, especially Uzodimma, there was a particular incident that happened that day, and the governor directed you to handle that case. I don't know if it's part of what that is going on here today. It's a different case.
So that was the first case he just talked about, and I'm happy that we are having this case being done here today.
I'm happy for that.
Honorable Commissioner, is government going to take up the follow-up of these patients after the surgery?
Yes, in fact, not just that the government is taking up, I want us to actually give kudos to who it's due. Regions Hospital has taken up to do the follow-up pro bono for us. So we need to say a big thank you to Regions Hospital for everything they're doing in Imo State.
Thank you.
VJ, you want to say anything?
No, I just wanted to thank you, all of you for coming and showing interest in spreading the word around that it is a very important area which is very neglected, the children. Everybody likes to do adult, they have issues with children or somebody who can't speak for themselves. So I thank all of you, the Imo government, the Commissioner of the government and the Regions Hospital and my friend Dr. Ainsley, to give me the opportunity to come and maybe start something for the long run here. Thank you so much, all of you.
Thank you.
So what, as this program progresses, the Honorable Commissioner and His Excellency, which I know is very passionate when you tell him this type of thing, should be able at least to sponsor 20 Imo State patients that can't afford it for open heart surgery. There are probably about thousands and thousands of them that need, but once you start small, and there are different ways of doing this. It's expensive to just sponsor one child completely. But if you identify other people that can pay half, and then you increase the number. For instance, if you identify 20 people you want to sponsor, if 10 of them can pay half of the fee, then that makes it 30. So it grows, spirals out like that. And once you do that, there are a lot of wealthy Imo State indigents in business that I know of. You people reach out to them. And once they know that the Commissioner for Health is keyed into this and doing it regularly, they will give funds to you towards doing that. I don't think 20, that would be the minimum I think you push should be eminent. If you do 200, it's not bad.
So I know that we look forward to having sustainability in this kind of surgeries. We are looking out for a better health indices in the states. And the basic thing is the fact that we will continue the good strides that we've started with. And I know that with these good strides, we will have a sustainable health indices and improved health indices in the states. Thank you very much.
Good morning. What's the name of it? Yeah. My name is Okorafor Eunice, mother to Victor Ifeanyi Chukwu Okorafor.
From where?
I'm from Okibo, Imo State.
Okay. So why are you here?
In as much as I can speak English very well, but I would like to use the mother tongue to testify why I'm here. I have money in Imo State, I have money in Okibo. And I be no nature, Anambra State. Talk on one okay. Arabi. I chapter in what near the Carabo. And I got a connected to law. As no lawyer and load here. And the kind of guy chapter now. We are going to have a maybe. They go a Jaguar believe. So I know in the chase of Kabogaraga, of whom and the doctors. I know that I'm here. One John will go to one see made operation. Samba. I am the chemotherapy. So was in many mistakes. Nagin the in a log of again, again, is a one part I can make a small. So I have a preserve. I'm a chaparral of Kowara and Imo State government that sponsor the operation. So all the can be transmitted one another. I'm a co-zero between last year. So I'm a make a lechineke. Only no carrier in East Widow Tata 29th of March, Cassette and a little common entrance. Nanichabet, so no law. You talk on my daughter to me. Marike school and a little exam. And then make game come because okay, I need so if was no but Chineke Mela, Sitopani and your game, Macanebo, Morogona, I see you believe in all good.
How old is it?
It's not 12. He marked 12th on 3rd of this month.
What's the name again?
Victor Ifeanyi Chukwu.
How do you feel seeing your son in this country?
My darling, it's not a good experience. I don't wish it to any mother. I don't wish it to any mother. No, the one in them got chop or gabiga. Young gabiga and sing. So, about me, he can a chineke na. Ometori, no chase in a berendo where the guy. ka steeti gọọmenti batara ya ọsọ.
So what's the message to His Excellency, the Distinguished Senator?
The truth, I'm very grateful. Obi dị m ụtọ rinne mgbe m nụrụ na gọọmenti mega ya, eziokwu ama m otu ọ dị m. So ana m ekele ya rinne ebe o chetara anyị ya, biko eziokwu na ihe a ga-eme erika, mana ọ bụrụ na ọ ga-ekwe me biko si nyetụrụ m ndị nne ndị ọzọ na-agabigakwa ihe a m gabigaga ụdịrị aka enyemaka, maka na ọ ga-eweta ọnwụ nye ọtụtụ ezinụlọ. Nwere ihe dị ka itetara ụra kpọ nwa gị ọza otu ọra kịta a na-akụziri ihe niile, mana nwere nke a na-ekwe ka o mee n'ihi na ike adịghị adị ime ihe ọbụla, naanị iwuligodo onwe ya ahụ ọwụcha ya kịta ọ ghasasịa. So ọ na-emezi ihe ọbụla a ga-emere ya ahụ emere, so obezie n'ime onwe ya ọ na-enwe mwute ma omi ndị nke a na-emekwana ya, ma omi ndị nke ịmagụ eme ya mgbe niile obi adịghị ya mma. So ana m ekele His Excellency ebe o wetụpụrụ aka enyemaka nyere ndị ogbenye ka ha na-asị ya biko ejisikwa ike ọ bụrụ na a ga-emekwara ndị ọzọ otu a. Okay,
in a few minutes from now, we will be entering the surgery proper. Yeah. So what's your prayer for him?
I already believe that God in heaven, who has started the job, will definitely finish it off by saving his life. Yes. And bring him out properly without any casualty, so that he grew up to be a big boy, and being big boy to testify what God has done in his life, so that he will live his life for God alone, knowing fully well that God is there for him all the time. So that's my message.
Thank you. How we meet you? What's your name?
My name is
Who? From where? Why are you here?
I'm here for my baby, Jason.
How old is he?
He's 6 months now.
Does he have any health challenge, and what is the health challenge?
Yes, he has open heart. I noticed it when he was young, 1 month old. So I took him to hospital. From hospital to FNC. So they now confirmed that he has open heart. So someone called me that governor is doing free medical in Imo State Specialist. So I went there. I saw governor one-on-one, calling him, telling him that my son has open heart, that we don't have 6 million for the surgery. He said the surgery is 6 million there. So he said, okay, we'll take care of the baby. They should admit us in Imo State Specialist. That is why I'm here.
Okay. Now, your son is a year, 6 months.
6 months.
It's 6 months.
Yes.
So how do you feel? Because I know your son is being operated right now. How do you feel?
I feel so happy. I'm very, very happy and appreciated for what Governor did for me and my family, and Jason, my son, today. May the good Lord guide and protect him. May the good Lord bless him and his family. Amen.
Thank you.
Thank you.
We are at Region Healthcare in Ngurichi, along Port Harcourt Road, where we have cases of heart problem. And right now, as I speak to you, the kids are being operated on, the one of 6 months and one of 12 years. All these is being carried out by the government of the shared prosperity of distinguished Senator Hope Uzodimma. Kudos for the government of distinguished Senator Hope Uzodimma. And we are expecting that many others who fall under these health challenges will also be part of this wonderful gesture coming in from His Excellency. Thank you. My name is Chinaza Nwoke, reporter.